Now this, and I know this is one of your areas, but this fascinates me. The fact that people can develop these sensitivities to light, sound, smell, even like Wi-Fi. I have some clients who were affected by Wi-Fi signals, but they've never had it before. So these things just suddenly emerge, these sensitivities. Why does that happen? And can it be reversed? Or how could we reverse them?
It's not something, I mean, that I know actually a huge amount about, scientifically speaking. It is something that I think people are going to be more and more interested in terms of post-viral syndromes and long COVID or COVID. It is interesting. In terms of, I think it's to do with sensitivity and focus, and somehow the calibration has changed in terms of how exquisitely or how sensitive you are to some things. But my clinical work is actually currently in autism and ADHD, and people with autism and autistic people and people with ADHD. Have a variety of sensory processing differences. And the interesting thing about sensory processing differences is sometimes they are hypersensitivities and sometimes they are hyposensitivities. So, for example, not feeling the need to have a pee, or not hearing distracting noises, but being very sensitive to smells. And what we know in autistic people and people with ADHD is that they have differences in their sensory processing. They're either more or less attuned to senses than other people, but it can change according to contexts and their and what's happening for them in the moment. So I would have thought that it suggests an underlying difference in sensory processing, full stop, but that is quite changeable. But in terms of what to do about it and how it can be changed, I think finding sensory activities that are pleasing rather than aversive is important. It's called going into the realms of occupational therapy, in which I'm not an expert, but like a soothing kit. So there may be some, and everyone is different in terms of their sensory preferences, but some people find particular smells really pleasing, or particular fabrics. And so having a go, and there is currently, obviously, isn't there, a lot of interest, you can't escape, in terms of things like weighted blankets, or wearing headphones to try and reduce noise. So I suppose having a toolkit of things that you go to that help regulate how you feel through your senses. And we know from autism and ADHD that a lot of that behavior is related to self-regulation.
Okay. Fascinating. So I guess that with the hypermobility, maybe we're just more susceptible to those.
Well, this is well, I think we may be just slightly more finely tuned in general.
Finely tuned,
And we in a group of people that we've been studying, I sound like some terrible what have you, but the hypermobile and anxious people who have been wanting, who are taking part in our study. We presented at a conference recently some interesting findings. These are all people who predominantly have anxiety. They don't have other diagnosed mental health or neurological issues. But we found that the more connective tissue features that were present in the individual, the higher the sensory processing scores, so sensory processing differences on an autism rating scale. These are just features of sensory processing differences. So you can imagine, and we need to replicate this in a larger sample and get it peer reviewed and all of this sort of thing. But you can imagine that there's something about the makeup of the body and the brain that will change how you
Yes.
experience sensation, and perhaps that is related to hypermobility.
Yes. Fascinating. So you touched on the neurodiversity.
Yes.
So what sort of research have you been doing into hypermobility and neurodiversity?
Okay, so it was one of the reasons why my supervisor first got interested in hypermobility as a concept. Was, I mean, and the terminologies are changing all the time, just as they are in hypermobility. So
Yes.
we previously used to think of some autistic people as having Asperger's syndrome. And my supervisor was doing a brain imaging study on Asperger's syndrome, and noticed that he thought that the male participants had a particular sort of look to them that he thought was related to hypermobility. So he was interested in this relationship. At that point, there were only really a few case reports of children, autistic children, having loose joints, marfanoid, people with marfans being more likely to have autism. Some relationships between hypermobility and ADHD in children, the hypermobility and dyspraxia link. So we started a study in our clinic where we see neurodivergent people. Yes. And whilst we were doing that work, some researchers in Sweden published this really fascinating study. So Sweden is a country that has excellent health registries, which is a great way to, in some ways, to do research. So you can link one condition with another. You can look a long time. It's all great in terms of getting answers to associations. And so what they found in Sweden was that if you had EDS or JHS, so hypermobile, symptomatic hypermobility, you're 7 times more likely to be autistic, or 6 times more likely to have ADHD. And what was quite striking about that is for these people to be in the health registry, they will have to have been diagnosed with both. So we know that there are a huge number of people, autistic people, with ADHD who are under the radar. We know that there are a huge number of people with hypermobility who are not diagnosed with joint hypermobility syndrome or EDS. So if this is just the tip of the iceberg, I believe. So that work shows the strong whole population-wide relationship between hypermobility and neurodivergence. Wow. We finished our study looking at neurodivergent people to see if they were hypermobile, and this hasn't been peer reviewed, but it is published on medRxiv. So if you Google Eccles medRxiv autism, it will come up. So we looked at a group of, I think, 105 neurodivergent individuals, a variety of autism, ADHD, Tourette syndrome, some combinations of 2, 3 of. And we found that they had more likely to have generalized hypermobility than controls, more likely to have generalized joint hypermobility compared to the population, greater autonomic symptoms than controls, and greater pain symptoms than controls. Wow. And I work in a adult ADHD, autism, Tourette syndrome clinic. And maybe it's something about the patients that I end up seeing, but I don't think so, because my colleagues report the same experiences. But this clinic, probably at least, around 80% of the women certainly are hypermobile, and a lot of them have POTS, chronic pain, chronic fatigue, gastrointestinal disturbance. I mean, there's a long history of autism and gastrointestinal disturbance. So in my clinical experience and in my research experience, they are very closely linked. But that is not to say all hypermobile people are neurodivergent or all neurodivergent people are hypermobile. But they seem to hang around together.
Wow. And so this is maybe to do with the fine, what did you call it? The fine balance or something in the brain. We're more finely tuned. I don't know.
Maybe. Calibration, the finely calibrated. Yes. Yeah.
Wow.
I gave you asked me, why hypermobility might lead to anxiety. I mean, trying to explain why hypermobility might lead to neurodivergence is much more complicated, but they definitely do seem to go together.
Yes. Wow. Well, amazing. Thank you for that research, because I know people have been talking about it for a long time, that is there a relationship, and then you're doing that research and working on that, and it's just fascinating. Oh, wow. Very quickly, I read some research when I was doing my research on for this podcast, EDS and eating disorders. And I think I found one paper.
Yes.
What's the relationship there with eating disorders?
Yes, I think there are a couple of papers now that explicitly link, hypermobility is overrepresented in people with eating disorders. If you've seen my YouTube video on neurodiversity and hypermobility,
yes.
I present some data which has not yet been published, where we link, we look at a group of people predominantly with anorexia, find that they have some autistic thinking styles that seems to be related to which is different in the hypermobile versus the non-hypermobile eating disordered people. So very high rates of hypermobility we find in eating disorder, and this seems to be related to a type of thinking called systematizing, which is kind of about how you look for patterns in the world, and I can imagine, and this is conjecture, so we need to publish that and get that out there, but that link seems to be there. Small group, but it seems to be there. I can hypothesize that if you are hypermobile, you're predisposed to potentially have gastrointestinal symptoms.
Yeah.
Pain, diarrhea, constipation, etc., etc. You may also be predisposed, and this is only something that is emerging, to be autistic or have autistic traits, which may include preference for routine, sameness, sometimes concrete or literal thinking, and also sensory processing differences. So you can imagine that the combination of this, of all of these different features on a background of more likely to experience gastrointestinal symptoms would mean that maybe disordered eating or difficulties with eating, which may be driven by texture preferences or sensation preferences, could lead into a frank eating disorder.